down a little bit in the body to the vagina. This is a huge focal point for women who are going through menopause and have become postmenopausal, because a lot of things are happening there. Some of them quite serious, especially if not treated. And Dr. Margaret, could you take over here? What's going on?
So just as I mentioned that there are estrogen receptors all over the body, there are definitely estrogen receptors in the vagina. And so lack of estrogen really plays a big role in vaginal health. The main thing that happens is the pH of the vagina when estrogen is present is around 5. And when if there's no estrogen, it rises, it goes up, it could go high as 7 or 8, or even higher. And what this means is there's a very big change in the bacteria that can live in different pHs with different acidities versus basic environments. And this change in pH means that there's a change in, we call the flora, the natural bacteria that live in the vagina. And so that just the pH change alone increases the likelihood of developing different kinds of infections, vaginal infections. Also, with this change, with this decrease in estrogen and or increase in pH, there's actually less collagen formed. And without this, the walls become thinner. They're less able to stretch. And this, with that thin, and there's less moisture. So all of that together can create an environment that, one, is very uncomfortable. People will describe this as feeling like sandpaper.
Mm-hmm.
And there's itchiness. So people are uncomfortable. There's pain. There's burning, and also pain on intercourse. So there's a lot of factors and a lot of symptoms that occur from this lack of moisture, lack of stretchiness, increase in pH, and an increase in infection. And if that's not bad enough, that higher pH and that change in flora can also make the urethra, which is present down there, which is where you urinate from, can also be affected. And so it increases the likelihood of a urinary tract infection.
Mm-hmm.
So these are areas which can be helpful. And really almost everyone eventually without estrogen will develop some vaginal dryness. And what can we do about this?
Well, see, that's interesting that you're pointing that out with all of these other areas of the body that we've covered so far. Not everybody is going to be affected, but in this case with the vagina, really, as you said,
eventually,
probably the vast majority of women, right?
Some people will be affected after a year of no estrogen.
Right.
Some people 3 years, some people it takes 10, some people it takes 20. Sometimes it's present, but there are no symptoms. So sometimes I'll have an individual where I can tell on my physical exam, the pH is 8, which is high. The walls of the vagina are very pale. There's no stretchiness at all. And so I know that there's dryness. But when I say to them, are you bothered? Do you have any itching? Do you have any burning? Do you have any pain on intercourse? No, it doesn't bother me. Okay, then you don't have to treat it necessarily unless you're getting frequent infections. But there are a lot of options for treating. There are moisturizers, there are lubricants, there are over-the-counter
Excuse me, and we also did an episode all about this too. But moisturizers are really used to moisturize the lining of the vagina. But whereas lubricants are really more for sexual purposes. Am I right? Pretty much.
Yes.
Okay.
Absolutely.
Just to be clear on terms.
Some people use natural oil products such as coconut oil. Be very helpful. Hyaluronic acid, which is over the counter. There are suppositories, there's cream. That can be really helpful because that not only improves the moisture, but it actually can bring in some more collagen and can help restore some of the normal vaginal epithelium and prevent infection and lower the pH. So that can be really helpful, the hyaluronic acid. And then, of course, if those aren't working, or for people who can take estrogen vaginally, there are tiny little estrogen tablets, creams, gels, etc., that can be used to really replenish.
Prescription you're talking about now from your doctor. That is what I have been on for 15 years. So it's a topical treatment, not systemic like hormone
And that's
therapy,
so important,
which was
right?
my choice at that time,
That's
and I
right.
stuck with it.
Doesn't get absorbed. It doesn't get absorbed.
Mm-hmm.
You know, maybe a trivial pain. And most people can take that. Even people who have had breast cancer, for instance, many of those can still take a vaginal estrogen because so little, if any, gets absorbed. However, there are some individuals that really cannot take it. Someone that might have had an estrogen receptor positive tumor that cannot take any estrogen, even vaginal estrogen.
Right.
And for those individuals, they can't take it. But for most, and that's why it's still prescription, but for most people, they can. But this is a really, really important area. And just as you said, Barbara, we've done episodes. We could talk for a very long time. And actually, I have several patients a day that come in with vaginal dryness who have been treated, not treated, et cetera. And it really is a big issue.
And the good news is that there are so many companies now in the last 3 years that have entered this space of menopause treatments over the counter or online. And so that there are a lot of very affordable options. And Dr. Margaret, you even mentioned some like, coconut oil that you can just buy from the supermarket. I have a friend who swears by coconut oil. So, there are a lot of options. So always our message is nobody should ever have to suffer. Nobody.
Agreed.
Too many options out there.